Hello everyone, this is Dr. Kishore Alapati. I'm a consultant colorectal surgeon working from Apollo Hospitals, Jubilee Hills. Today we're going to briefly discuss about hemorrhoids in short 3 minutes. Hemorrhoids are basically small blood vessels that arise in the anal area, and we technically tend to call them anal cushions. Almost all human beings have hemorrhoids to some extent, and they're classified into grade 1, 2, 3 and 4. Depending on the significance of the symptoms that they're causing in regards to pain or burning or itching or bleeding, we usually tend to classify them along with the size of that. So unless otherwise there are associated symptoms with the presence of the hemorrhoids, we usually tend not to treat them surgically, which means that just the mere presence of hemorrhoids doesn't necessarily warrant a surgery always. And a good number of times, if you're having any of these symptoms like burning, itching, and or occasional bleeding from the hemorrhoids, a good number of times dietary modifications and lifestyle modifications will help alleviate the symptoms significantly. Even after trying the dietary modifications and local ointments, if you're still having symptoms secondary to the hemorrhoidal disease, then we tend to treat them medically with medications. Usually we give this a try of about 2 to 3 weeks, and if you haven't noticed any significant improvement in your symptoms, that is when typically we recommend a surgical procedure to get rid of the hemorrhoids. So again, remember, the presence of hemorrhoids doesn't necessarily warrant treatment all the time. Only if they are causing you symptoms, which is either an anal burning or itching or bleeding or pain, then we tend to treat them either medically or surgically, depending on the severity of the symptoms and the size of the hemorrhoids that most of your patients have. Constipation is one predisposing factor for the hemorrhoidal disease, so make sure that in your lifestyle changes, you definitely drink enough amount of water. Make sure you take adequate amount of fiber on a daily basis, which comes in as your leafy vegetables or green leaves in your curries on a regular basis, or salads, however you want to consume them. So as long as you're consuming them on a regular basis, we should be able to get adequate amount of fiber as a dietary intake, and that would also ease the symptoms of constipation. Once the symptoms of constipation have eased up, then definitely you will notice a significant decrease in the intensity or the severity of the hemorrhoidal diseases that you have. So make sure you maintain your diet, make sure you maintain your adequate water intake, and on top of that, go for your natural treatments like laxatives and things like that. If not, definitely try medications for 2 to 3 weeks, and even if after that you continue to have a significant amount of symptoms, that is when you would require surgical treatment for these hemorrhoids. Thank you.